The United States is seeing a massive increase in COVID-19 cases again. The country's daily average case number is now 170,000 and the average death toll is reaching 1,701 a day. 1 million cases were recorded in just 1 week, making the national COVID cases 13 million. According to the Institute for Health Metrics and Evaluation, the US death toll could nearly double by March. The national death toll currently sits at over 244,000 and could reach nearly 440,000. As the United States finishes up Thanksgiving and heads into the Christmas period, Dr. Fauci warned Americans to try and avoid large gatherings and keep all of the regulations that have been in place since March in the hope of slowing the spread.
Keep the gatherings, the indoor gatherings, as small as you possibly can. We all know how difficult that is because this is such a beautiful traditional holiday. But by making that sacrifice, you're going to prevent people from getting infected, because we know for sure that people who are without symptoms, innocently, with no malintention at all, goes to a party or goes to a gathering, gets together indoor, you let your guard down, you obviously have to take a mask off if you're eating or drinking. Try to avoid that as much as possible. A sacrifice now could save lives and illness and make the future much brighter as we get through this. Because, George, we're going to get through this. What we don't want to see is yet another surge superimposed upon the surge that you just described, which we'll realize 3.5 weeks from now if we don't do these public health things.
States are starting to react to the surge in cases. Most of California entered a 1-month stay-at-home order, which meant that you weren't meant to leave your house or partake in non-essential activities between 10 p.m. and 5 a.m. New York then began to close schools a few weeks ago to slow the spread. But the rise in hospital beds is what is worrying. Some state hospitals are starting to see record numbers of intake. According to the COVID Tracking Project, hospitalizations are now 50% higher than they were in the summer and spring. Nearly 90,000 Americans are currently in hospital with COVID-19 today. A large majority of Wisconsin hospitals, for example, are operating at peak capacity, which has seen 87.3% of hospital beds occupied across the state and 88.8% of ICU beds in use.
The crisis is urgent. Across our state, families, workers, and communities continue to face the challenges of the COVID-19 pandemic. Our healthcare workers are going to work every day, working 3, sometimes 4 shifts in a row, often having to reuse or share masks and putting themselves and their families at risk to do their jobs. We owe them our thanks, but they also deserve our attention and action. I'm concerned about what our current trajectory means for Wisconsin's healthcare workers, families, and our economy if we don't get this virus under control.